Hi everyone, welcome to Anatomy Made Easy. Do you also get confused by all the bones of the upper limbs? Don't you worry. In the next 10 minutes, I will help you remember all 32 bones of the upper limb in the easiest way possible. No complicated terminology, no boring memorization, just simple tricks that you will actually remember during exams and viva. So, grab your notebook and let us begin. Before jumping into individual bones, let us first understand the overall picture. A single upper limb has 32 bones. Instead of memorizing all 32 together, well, divide them into 4 simple regions: shoulder girdle, 1 clavicle and 1 scapula; arm, 1 humerus; forearm, 1 radius and 1 ulna; and finally, the hand, 8 carpal bones, 5 metacarpals, and 14 phalanges. So the formula is 2 plus 1 plus 2 plus 27, 32. Much easier, right? Now let us go region by region. Let us start with the pectoral girdle. There are just 2 bones here, the clavicle and scapula. First, the clavicle, or collarbone. It acts like a bony bridge between the upper limb and the actual skeleton, helping to keep the shoulder positioned away from the trunk. Next is the scapula, commonly called the shoulder blade. It is a flat, triangular bone located on the posterior aspect of the thorax. Now, there are a few important landmarks you should know: the spine of the scapula, the acromion, the coracoid process, and the glenoid cavity. And remember the glenoid cavity because it has an important job. It acts as the socket of the shoulder joint, where the head of the humerus fits. So, clavicle and scapula, that's your pectoral girdle. Now let us move down to the arm. The arm contains just 1 bone, the humerus. At its proximal end is the rounded head of the humerus, which articulates with the glenoid cavity. Just below the head are the anatomical neck and surgical neck. And here is an important clinical point. A fracture through the surgical neck of the humerus can injure the axillary nerve. Definitely one to remember for your exams and viva. Next, we have the greater and lesser tubercles, which provide attachment for several muscles around the shoulder. Moving down the shaft, we find the deltoid tuberosity, the attachment site of the deltoid muscle. And at the distal end, we have the medial and lateral epicondyles, which are important attachment sites for muscles and ligaments around the elbow. So remember, humerus, the single bone of the arm. Now we come to the forearm, and thankfully, there are only 2 bones, radius and ulna. Here is the easiest way to remember their positions. The radius is on the thumb side. The ulna is on the little finger side. Try this with your own hand: thumb side, radius, little finger side, ulna. The ulna also forms the prominent bony point of the elbow. That point is called the olecranon process. So if you remember just 2 things, radius, thumb side, ulna, little finger side, you'll rarely mix them up again. Now we've reached the part that most students love to hate, the carpal bones. There are 8 carpal bones, arranged in 2 rows. And yes, there is a classic mnemonic to help you remember them. Some lovers try positions that they can't handle. Let decoded. Some scaphoid lovers lunate try trichotrom positions pisiform that trapezium they trapezoid can't capitate handle hemate from lateral to medial. The proximal row is scaphoid, lunate, trichotrom, pisiform, and the distal row is trapezium trapezoid, capitate, hemate. Say the mnemonic a few times, and these names become much easier to recall. Now let us add 2 quick clinical points. The scaphoid is the most commonly fractured carpal bone, and the lunate is the carpal bone most commonly dislocated. So remember this simple pair: scaphoid fracture, lunate dislocation. These are classic anatomy and orthopedic exam questions. Next, we have the metacarpals. There are 5 metacarpal bones, numbered from the thumb side. So first, second, third, fourth, and fifth. The first metacarpal belongs to the thumb, and the fifth belongs to the little finger. Now, an important clinical point: I. Boxed fracture commonly involves the neck of the fifth metacarpal. Think about someone punching a hard surface, hence the name boxed fracture. So whenever you hear boxed fracture, think fifth metacarpal neck. Finally, we have the phalanges, the bones of the fingers. And this part is very easy. The thumb has 2 phalanges, proximal and distal. The other 4 fingers have 3 each, proximal, middle, and distal. So the calculation is 2 in the thumb plus 12 in the other 4 fingers, 14 phalanges. Here is the easiest way to remember it. Thumb 2, other fingers 3 each. And that gives us a total of 14 phalanges in one hand. Okay, quick test time. Pause the video and see how many you can answer without looking back. Question 1. Which side is the radius on? Question 2. Which carpal bone is commonly described as boat-shaped? Question 3. Which carpal bone is most commonly fractured? Question 4. How many phalanges are present in one hand? And finally, which metacarpal is commonly involved in a boxed fracture? Pause the video and answer them yourself. Ready? Let's quickly check. Radius, thumb side. Boat-shaped, scaphoid. Most commonly fractured carpal, scaphoid. Phalanges, 14. Boxed fracture, fifth metacarpal neck. All right, we've covered the carpal bones. So let us do one quick revision before we move to the final summary. The 8 carpal bones are arranged in 2 rows. Starting from the thumb side, the proximal row is scaphoid, lunate, trichotrum, and pisiform, and the distal row is trapezium, trapezoid, capitate, and hamate. Now, there are a few easy associations that can help you remember them. The scaphoid is boat-shaped, the lunate is crescent-shaped, the trichotrum is triangular, and the pisiform is pea-shaped. In the distal row, remember that the trapezium articulates with the first metacarpal and is associated with the saddle-shaped thumb joint. The capitate is the largest carpal bone, while the hamate is easy to identify because it has a hook called the hamulus, and of course, don't forget our mnemonic. Some lovers try positions that they can't handle. Now for the clinical pearls. The scaphoid is the most commonly fractured carpal bone, while the lunate is the most commonly dislocated. And finally, remember the numbers: 8 carpals, 5 metacarpals, and 14 phalanges. Together, these bones give the hand the stability, movement, and strength it needs for everyday activities. So don't just memorize the names. Understand where these bones are and what role they play. That's what makes anatomy much easier to remember. And now, let us put everything together one last time. We started with the 8 carpal bones, 4 in the proximal row and 4 in the distal row. Then we looked at 2 important clinical points: scaphoid, most commonly fractured; lunate, most commonly dislocated. Moving forward, we have the 5 metacarpals, numbered from the thumb side to the little finger side, and finally, the 14 phalanges. The thumb has 2 phalanges, while each of the other 4 fingers has 3. So when you put everything together, 8 carpals plus 5 metacarpals plus 14 phalanges, 27 bones in the hand. And when we add the clavicle, scapula, humerus, radius, and ulna, we get a total of 32 bones in one upper limb. Here's the bigger picture. The carpals provide a balance of stability and movement. The metacarpals form the framework of the hand and help with grip, and the phalanges allow precise movements and function of the fingers. So remember, anatomy isn't just about memorizing bone names. It's about understanding how these structures work together to produce movement, grip, and function. If you understand the arrangement, the numbers, and a few key clinical associations, the entire upper limb becomes much easier to remember. Understand, practice, revise, and never stop learning. That's how you make anatomy easy.